Welcome to another edition of Health Department Roundtable. I'm Chris Schultz, Chair of the Abington Board of Health and your host. With me tonight is our public nurse, Lindsay Wright, our Health Director, Marty GoLightly, and joining us is our Representative Alyson Sullivan. Thank you, everybody.
Thank you.
Thank you.
So the first thing we want to check in on is where Abington is at with current active cases. Lindsay, I believe you said we have 45 currently?
There are 45 active cases, which means 1,591 have been removed from tracking, and we have 49 residents in quarantine.
Up a little bit from earlier this week, but still trending in the right general direction.
We're under 100, which is a good benchmark to be under.
I'd like to be under 1, but I get it.
We'll get there.
Soon, we'll get there.
So that leads us into the what's on everybody's mind right now, and used to be a happy topic for us, but it's a contentious one now. The state of COVID-19 vaccinations. So what we've learned from Secretary Sutter this week is that towns will no longer be involved in the vaccination process. Is that my
Well, kind of.
Okay.
It's complicated. We're still giving second doses if we got the first doses here. And I wanted some happy news is today I was informed that Abington will receive its allocation of second doses for the clinics for first responders that we've had scheduled for next week. So hooray. If you were given your first shot 4 weeks ago at our fabulous EDS at the Abington High School, I'm happy to say that you'll be able to come back at the same time that you came the first. Well, Lindsay will take care of the times and we'll let you know. We're going to hint it a little bit. But on Wednesday of this week, this upcoming week, we'll be able to give you your second dose. We're very excited to that. Also, we are working very closely with the Brockton Housing Authority, who runs the Abington Housing Authority, senior affordable housing in town, to be able to order doses for that very vulnerable population to be able to deliver to the vaccine. Lindsay and Justin Silva and myself will be going door to door or asking them to come to the common areas to do that there. So while we cannot do the large clinics for our most vulnerable populations, which is what we want to do, especially for those who can't travel all the way to Gillette, we are still happy to be doing something in this fight against COVID. And we are leveraging our unique set of skills and resources to go to those homes to give those most vulnerable populations. And those are the people that we are fighting the hardest for. I want to reiterate with what Representative Sullivan and all of our other elected officials said at every meeting we've ever had, is we are not saying that there is no place for mass vaccination sites. What we are saying is we want the opportunity to deliver vaccine here locally to those people who cannot travel or for some reason don't want to travel or whatever the case may be. So some good news and some bad. But at this point, any win is a win, and we are just happy to continue this fight against COVID because nobody wants us out of this more than me and Lindsay. I promise you that.
One of the concerns that we've been fielding, and I know that you've probably been getting a lot of calls in the office about, is our over 75 population that got their first dose. So they're, as of right now, we believe they'll be getting their second dose, and their appointments are still on, correct?
Yes.
Yes. And I attribute that to the assurances we got from the state. And I want to thank Representative Sullivan again for joining us tonight. Thank you, Alyson. Really, really appreciate having you. And I know that she's been doing a lot of work behind the scenes that fighting for those seniors who were given the first dose and who will get the second dose now in Abington. So thank you for that. And I'll throw it over to you if I'll shut up now.
No, I know that we got the secured second doses. Obviously, we're advocating to get more doses, to give first doses and second doses. But as of right now, it's on that regional basis as far as what Marty and I and Lindsay have all kind of been discussing what that might look like here in Abington or more locally for our constituents who don't want to go anywhere other than more localized to get their vaccine. So like you guys, I've been hearing from constituents regarding the second doses. I've tried to assure them that the state has assured us that they will be getting those second doses. And I was happy to hear that Abington is receiving those, 200, I think, right, Marty, 200 vaccines for the second doses. So it's looking positive in that sense. Unfortunately, there's been some surrounding communities that haven't gotten their second doses. So I've been working with the state to hopefully secure them their second doses as well.
And are we looking? So, and this is a question I've seen, so I'll ask: Are we looking at trying to do something as a regional group with other towns in the area, so that we can be administering vaccines going forward, or is this kind of a wait and see approach right now?
Yes to both. That the work to regionalize won't stop, but the plan has to be sound, it has to be sustainable, and it has to be equitable. So I've talked with Alyson about this a lot. We don't want to overpromise and underdeliver. We want to do the opposite of that. So I have meetings all next week with important members of the other communities in the planning process. What's important to us is to keep advocating for those who feel like they're left behind. And if a regionalized approach is best to target that community, then we will continue down that pathway. If it's not, we will look in other directions. I don't want to just make a decision to make sure that we're doing something. I want to make sure that what we're doing adds to what's happening around us, not just doing it for the sake of doing it, and that it is targeted. We can fill a niche. Our paramedics are amazing. Our school nurses are amazing. Our COA staff knows everybody over the age of 60 in town and in other towns. So if we can leverage those people to target the ones who are most in need of it, then that's what we should do. And if a regional site satisfies that requirement, then we'll attack it. And our team is amazing, no problems. But we want to make sure that we're all on the same page before we commit to any regional efforts. And also, there's the proximity problem, and the state has certain wickets that they wanted to hit. And we want to make sure that I don't want to just do the bare minimum. We're not bare minimum people here. It's got to be, if we're going to do it, we're going to do it well. And we're going to do it to 100% of our capabilities. So we want to make sure that we explore all those options. And I know, Representative Sullivan, you've been talking to a lot of other towns, not just us. And I believe they share the same mentality.
Oh, most definitely. Yep.
Yeah, it seems what I've been hearing a lot of frustration. We know at the town level, you guys have been training for this for ages. You're prepared. A lot of investment has gone into the infrastructure and making sure that we have people in place to do this. And unless I'm mistaken here, it doesn't seem like at the local level, we've been involved in the conversation at all. These are decisions that are just being handed down without much explanation or input. And Representative Sullivan, that's one of the reasons we're thankful for you, is because we have a voice. Whereas I think a lot of people right now are just feeling, both private citizens and those in healthcare, feeling disenfranchised.
I think especially from what we're hearing on our end in the office is people feeling left behind, right? That they're being overlooked now that the new phase came out and they still haven't been able to secure a vaccine, with the site crashing in a matter of moments of it, opening up for vaccine scheduled appointments. I think we were told on the call with Secretary Stubbs, it was almost 2 million hits in a matter of 30 minutes, which is something they haven't seen since the beginning of the vaccine rollout. So I think what we need to realize is that if we still had those local levels of being able to vaccinate, maybe there wouldn't have been such a big hit on the mass sites scheduling database. So, none of us have ever said mass vaccination sites aren't working, because they definitely will. They'll definitely be able to vaccinate a large number of people who feel safe and secure about going to those sites, who feel that though they can get to those sites, be able to physically walk to those sites if needed, especially in Fenway, because we've had conversations amongst ourselves with the hard part of getting into Fenway, right? There's no easy access to Fenway even without a Red Sox game going on. So the local sites is just an extension of those mass vaccination sites. And none of us are saying that we should get rid of them, because obviously they're doing their job. They are vaccinating a number of people on a daily basis. However, if we can continue, Marty, how many did you vaccinate on last Wednesday?
Last Wednesday was a smaller clinic of mostly first responders, and it was only like 57.
And that's just smaller.
55.
Right. Yeah. And a larger vaccine, it would be how many on a vaccine day?
Oh, we could do, I mean, without skipping a beat, we could do 250 before lunch. We've done 187, I think, was the biggest day.
Right.
And we didn't stress resources
No.
near to capacity.
Right. So if you just add, if you think about all the towns across the Commonwealth to be able to do, you know, whether it be 100 to 200 vaccines on any given day, that just adds to the amount of people being vaccinated. And that's the whole intent behind getting vaccinated, so we can get to the new normal, or I should say the old normal was what I like to go back to. But it's not a personal attack on the administration. It's not an attack on anyone trying to do their job. It's just that they should be giving you guys who have been, like you said, training for this for years to be able to do your job here. So we're going to continue to advocate for that. But no, I want to make sure everyone's clear that no one is advocating against the mass vaccination sites.
No.
And also, Marty, if you can clarify for me, but my understanding from the letter and the talks with Secretary Satis and the COVID task force is that if someone is homebound and hasn't left their house in, say, 365 days, they'll be able to have vaccines delivered to their home if they qualify under that by our local boards of health, correct?
100%. And not only that, I don't know, this is months and months ago, maybe as early as July or August, Lindsay and I and Suzanne DeJetberg over at the Senior Center and her staff, we've been collecting the names of those people and waiting for this opportunity to do so. So it's not just saying, and I know there's been a lot of talk about plans on our local Board of Health calls. I assure you, the one thing that we know how to do is plan for an emergency. This is bread and butter. This is 101 stuff for us. This is the things that we are good at. And the only thing we need is the stuff to execute our plans. Don't tell me how to do it. Give me the opportunity to do it and watch me amaze you. Right.
Yeah, because you guys ranked Lindsay. What was it that you told me yesterday, I think it was? How much percentage?
Oh, 102.
Oh, our administration rate is 102%.
I want to talk about that real quick. So
that's how good you guys do your job. Okay, you don't just do it good, you do it great.
We did hear some rumblings from some people in DPH, and I do want to admit, like, these are dedicated public health professionals too. So we shouldn't bully each other. We're on the same team overall. So let's be cool about that. But they said that Abington's administration rate was lower than normal. And I want to remind everyone that we were acting as a hub for a lot of the other communities to come and pick up their vaccine because we set up our infrastructure a little bit earlier than everybody. So we were able to deliver vaccine to those communities who really would have had a hard time going to the Brockton pharmacy or going to other places to get it. So it was really kind of misleading to say that our administration rate was low when I had vaccine in a freezer for someone who was coming to pick it up in a few hours. So our administration rate in Abington was well over 100% because we're able to draw extra doses out of those vials. So we're so good at this, we break mathematical rules.
That's the team you want to be on. Well, I want to remind people, this is what I think people need to hear, that there is a lot going on behind the scenes. We're continuing to work for you. Things are happening. And hopefully at some point we can be using these mass vaccination sites to supplement, not supplant, our local efforts to get everybody through this. I mean, just as a private citizen and somebody who's worked in both healthcare and IT, 2 million people crash in a site. When these phases ramp up and we move into new categories, there's going to be a hell of a lot more than 2 million people. Yep. So I don't see this getting better unless we start bouncing back.
Let us take some of the strain off of that infrastructure. Let us reduce the need for that. That's what we can.
By adding to it, we can get through it faster. And that's our whole point. Is let us help.
Well, even on the state website, so I was looking at it this morning just because I do like to check whether Abington's back on it or not. And you know, it says the local appointments are updated daily. So where you see these mass vaccine sites, they're only updated weekly. And unfortunately, it's that one day on Thursday where everyone's trying to get in for that next week to get an appointment. It's just not something that's going to be able to sustain over the course of the different phases opening up. So that's definitely going to be an issue.
Yeah. We're just looking to take the pressure off and make this work for everyone.
Mm-hmm.
Yep. I do want to give a quick plug to the health department roundtable we did with Dr. Boulay and my friend Tom, our science communicator friend. I know that there is still some trepidation, and I know that the administration is pushing local health departments, local boards of health, and their representatives to make sure that people understand that the vaccine is safe and effective. Please check out that video. It's a really good job. If you have any questions, email us, call me. I am a science nerd, and I pride myself on being able to break down very complicated scientific jargon into very easily digestible bits so that someone can get a real sense of the safety of this vaccine. I assure you it was not rushed. The science is not new. The vaccine itself is not even new. Just what we're vaccinating for is new. So please check that video out. Please ensure all of your elderly people that the vaccine is safe. The vaccine is effective. It's also effective in a large part against the variants. So please check out those videos and share that with all of your friends and family, and let us know if you have questions. That's the only way we get out of this, is get that vaccine.
And if anyone's interested, that video is on Abington Cam's YouTube channel. So you can find it there and learn everything you wanted to know about the vaccine.
Yep. And thank you, Abington Cam, for hosting this and putting that video up there.
Excellent.
I know I've sent it to a few residents. I've sent it to a few family members who were unsure, and it's definitely helped make an educated decision for those individuals.
And further, Tom is, this is just like, these are the things that we're proud of, that Abington, I think, has done very, very well. Dedicated safety officer at every event. Now he's a volunteer, and he's a microbiologist by trade. He comes to all of our events, and he's there if you have questions. So if you have concerns over what happens to your body, then please ask him. He's even a bigger nerd than I am about this stuff. So that's why he's there. We brought him in to be able to answer these questions and to make sure that we're leveraging all of our resources, intellectual and physical, and all of that, to make sure that our residents and residents of everywhere are as safe and comfortable as we can make them.
Mm-hmm. Excellent. All right, before we wrap up, 2 points that I want to make sure we clear up for people. First of all, I think we touched on this. So if you go to the VaxFinder site, currently Abington High School is listed as a site, but it's not an active site, correct? We don't.
Correct.
So I know people seem to be getting confused about that, and that's nothing on our end. We're without vaccinations, so. Currently.
We're still hopeful.
And that leads me into the second part. Is there anything developing in the next week that we want to make people aware of? Any conversations or?
I do know, I looked at the registration list for our first responder clinic, the second doses that's coming up on Wednesday. I have emailed individuals who didn't register for the second shot the link. So if you're watching and you got your first shot with us, please either register or call the office, and we'll make sure that we know that you are coming. We've accounted for you, but we do need your registration. It's a little bit easier if everything's done beforehand.
I do want to say thanks to Representative Sullivan for coming on these things and standing up for our community, doing the yeoman's work of getting in there and asking me and Lindsay and spending time with us to find out exactly what it is like on our level. And it's reassuring to me as a resident of Abington to know that my rep is fighting as hard as I am. Right. So thank you, Alyson. That means a lot to us, and I hope it means a lot to the constituents as well. And on a bipartisan basis, you were out there with, irrespective of party, everybody was like, let's go, let's get it. So, I mean, that was comforting to see, and it meant a lot.
Well, because it's about people, it's not about politics and all this. And that's something that I think is very important that we get across it. We're just trying to make sure that everyone's safe and we can get back to normal. I know that kids want to get back into schools, teachers want to get back into in-person teaching. People just want to go back to their normal lives. In order to do that, we need to get vaccines. And standing with my two colleagues who are both Democrats, but are great friends of mine, advocating to get vaccines more locally, I think is a very important message to get across, that we are all in this together and we're trying to get through it together. So thank you to you guys. You guys are doing such a great job. I was honored to be able to be there on Wednesday and yesterday, well, Thursday. I don't know when this is going to be. And all of it. And I look forward to continuing to be able to be there when needed. So thank you.
We appreciate you coming down Wednesday and checking out the site and being there with us yesterday.
I'm so sad that I missed Jared singing. I actually texted him and let him know that, I'll catch it next time.
Alyson, continue to put the word represent in representatives. Thank you.
Thank you.
So again, I want to thank all of you for coming on tonight. I enjoy nothing more than spending my Friday surrounding myself by people at the top of their game. Thank you for all the hard work you do. I know it's been a long week, so I'm not going to keep anybody any longer. We will be back again next week with another update. So if our listeners / viewers have any questions or anything they want to address, you can reach us. You can through Abington Cam, through the Abington Board of Health page on our town website. There's a number for the health department office, and Representative Sullivan is one of the most accessible elected officials I know. Yet her contact information is out there. So please don't hesitate to reach out if you have questions. And thank you again, everybody. Have a safe weekend, and we'll see you next week.